My team and I here at Boomer Benefits have been in the business of going the extra mile for our clients since 2005. During this time, we have helped to resolve just about every Medicare issue under the sun. There's one common theme we've come to know, and that is Medicare is far from perfect. There is no shortage of Medicare insurance agents and agencies around the country and in your backyard who can help you enroll in a plan. Instinctively, people ask me, how then are we any different from all of the others? Well, when you enroll with Boomer Benefits, you are enrolling to receive legendary customer service from my team for the life of your policy. Rather than signing you up for a plan and leaving you high and dry when an issue arises, that is the time when my team really gets to shine for you. Whether your important medication is being rejected at the pharmacy or you received an $18,000 bill that you don't know if you owe, my team knows how to help. Hi there, I'm Danielle Roberts, co-founder here at Boomer Benefits, and in this video, I will show you how my team helps our Medicare Advantage clients and the level of service that you can expect when you work with my staff. Before we get started, be sure to hit the subscribe button below to keep up with any important Medicare updates that we release here on YouTube. And if you have a Medicare question or video suggestion, drop it in the comments below. I love hearing feedback from you directly. The Annual Election Period, or AEP, is our busiest time of the year, and it starts October 15th and goes through December 7th. With millions of beneficiaries all trying to change their Medicare plans in 7 weeks, it's absolute mayhem here in our industry. The Annual Election Period is your chance to drop, change, or enroll in a Medicare Advantage plan or a Medicare Part D drug plan. Whether you are switching from a Medigap policy over to Medicare Advantage or just enrolling in a new Medicare Advantage plan, we can certainly help you. We represent the top-rated carriers around the country, so we can research and compare the plans in your zip code to help you determine which one fits your healthcare needs and your budget. When you shop your Medicare Advantage plan with us, we will gather a list of your most important doctors along with your medications if you choose to share them, so that we can make sure to find you a plan that includes your doctors in the network and your drugs on the formulary list of covered drugs. Before any agent can cover plan details with you, you must sign a scope of appointment form, and this is a Medicare required document giving us permission to discuss certain insurance products with you. Once we have this signed, we can discuss the plan's coverage, its networks, the added perks, and cost sharing amounts so that you'll know exactly what to expect if you enroll in the plan. Since the Annual Election Period is our busiest time of the year, please don't wait until the last day to give us a call. The earlier is always better. Take a moment to save our number, which is 817-249-8600. Now let's look at some of the common hiccups that you could face with various Medicare Advantage plans throughout the year and how Boomer Benefits can help. One pitfall our client service team helps all clients with is when a claim is denied. If you receive a bill for a service and you're not sure if you need to pay it, you contact our client service team. Likewise, if you receive an explanation of benefits form indicating why the claim got denied, we want to see it. You can fax or upload a secure copy of the medical bill, and your assigned client service team member will determine whether you truly owe the money or if the medical provider sent it to you in error. These kinds of errors are common when providers file claims using the wrong billing codes. And when that happens, we have the experience to help it. Here's a recent example of this in action. A client called us and said his Medicare Advantage plan denied a medical imaging service. The service in question is traditionally covered by Medicare Advantage plans for routine screenings, so our team member knew that it should have been covered. After investigating further, we found that his service was initially denied due to the wrong gender being listed on the claims paperwork. Simple errors like gender or date of birth not matching the records can cause a denial. Then there was also an issue raised questioning medical necessity. After assisting and escalating the matter with the facility that filed the claim, They were able to send over additional medical records that proved that the service was in fact medically necessary. The client's claim was then covered in full by the plan, and his $223 balance was reduced to zero. Now, imagine if he had enrolled in that plan directly with the insurance carrier and did not have access to the service team here at Boomer Benefits. He would have had to call the facility and fight for this refund all on his own without the knowledge that we have. He wouldn't have had the background knowledge to know why or how certain billing errors happen that can cause these denials. In many cases, the person just pays the bill because they don't know any other way to resolve it. And this is where we add value to your Medicare insurance. When you enroll in a Medicare Advantage plan, you will use the plan's network of providers to get your care. Insurance companies use networks to control costs in the plan, and that means that sometimes they will require prior authorizations before they will cover certain expensive tests or procedures. Your provider will submit forms to the insurance company to request the procedure, and here's where things sometimes bog down. The forms get lost in the shuffle, and the waiting then drags on. If and when this happens, we tell our clients to just make that call to our client service team. They are pros at tracking these forms down and requesting that they be expedited or completed so that you can get the medical care that your doctor has recommended. Another way we help our Medicare Advantage clients is by conducting provider directory searches. If you are about to visit a new doctor and you want to know if they are in network with your Medicare Advantage plan, just give us a call and we can help you check for this. Or maybe you move to a new city and you're having trouble finding a provider who is accepting any new Medicare patients. No worries, just call us and we'll do all the legwork to find you a doctor who will see you. The same also goes for diabetes supplies and vendors who provide durable medical equipment. If you have a Medicare Advantage plan through Boomer Benefits and need assistance locating oxygen providers or insulin pump suppliers who are in the plan's network, our service team is always just a phone call away. However, our assistance doesn't even stop there. Now, let's say you lost your Medicare Advantage card. We understand how inconvenient this can be for you, so just give our service team a call. Recently, we had a client whose purse was stolen, and among all her other valuables lost was her Medicare Advantage card. Thankfully, she had her policies through Boomer Benefits. She called our client service team to help her get a new card, and she needed this card as soon as possible so she could pick up an important prescription at her local pharmacy. We helped her get in touch with the carrier. She had temporary ID cards immediately that same day and new cards in the mail within just a few more days. Being in the Medicare industry for over 15 years, I can assure you of one thing, and that is that Medicare Part D will drive you nuts. Did you know that the drug coverage offered through Part D and Medicare Advantage plans have various medications that come with specific restrictions? Some drugs can have a quantity limit or a prior authorization, which can cause you delay in getting your medications. A more challenging restriction is something called step therapy. The plan may not fill your prescription until you have tried an alternative drug that is less expensive. When this happens, you can file a drug exception to try to get the medication you need to be covered, but it involves getting your doctor to provide more information on why you need to have this drug covered right away. Our team can walk you through exactly what you need to do in this situation. Sometimes this may involve a conference call to the insurance carrier. We'll get the right people on the phone and stay with you through the call. Requests for drug exceptions can sometimes be denied despite our best efforts. In that event, we can provide drug pricing information that you can share with your doctor. Physicians are often unaware that a medication they prescribe has a high copay on your plan. We'll provide the pricing information to show your doctor, and perhaps he or she can find other solutions for you that are within your budget. Another common issue our client service team helps with is coding errors. Simply put, medical coding is the code your doctor's office uses to identify a service that you have received. This code will then determine how your plan will pay and how much you will pay for the medical service. It's very common for coding errors to occur where your doctor's office staff chooses the wrong code or the invoice they send to your plan, and then you are charged an incorrect and unexpected amount. This coding error could make you believe you owe thousands of dollars for a procedure that actually should have been covered without question. Here's an example of a coding error that our team helped resolve recently. A client of ours was billed $281.20 for a preventive screening colonoscopy, which the Advantage Plan benefits indicate has a zero copay and no deductible. The client reached out to our claims team, and our team found that the claim submitted by the hospital for the facility charge was not coded correctly. In fact, the claim should have been covered with zero out-of-pocket costs. After our team contacted the medical facility, the claim was then reprocessed, resulting in a zero balance for the client. When you have your Advantage Plan with us, we will guide you through the process so that you have the high success rate in getting your coding errors resolved and saving you money while you are at it. Does this sound like a team that you want to have on your side for no additional cost to you? If so, give us a call. All of our services are 100% free, and you'll pay the same premium whether you enroll in a plan directly through the carrier or through our team. But when you enroll through Boomer Benefits, you will have complete access to that legendary client service team. If you want to learn more about our Boomer Benefits team, watch this video next.